Hey everybody, so welcome back. We're going to talk about hearing loss and deafness today. And just like one of the caveats that I give in a lot of these lectures is that this lecture I probably say this every single time, but this lecture feels like more than anything else, oops, I'm going to turn on my other light here. More than anything else, I think it does an injustice to the scope and the scale of what we could probably talk about. This is probably going to be like a half hour long, and there's just so much to talk about. So I'm going to cover the basics of it. And then, I'll probably pepper in a little bit of other stuff throughout, but nevertheless, let's talk about just the basics here. I am going to skip over a lot of the anatomy stuff and a lot of the testing, how do you test the auditory system and that kind of thing, just because I don't think we need to know it as therapists and as counselors to do rehabilitation counseling, vocational counseling, or mental health counseling. I don't think we need as much of that. Is it important? Yes. If you're paying for a graduate degree and you're expecting to go work with actual clients, absolutely should go read that and know that stuff. But we're going to skip over it just for the sake of time here. But know that it's in the textbook. It's important. It's valuable. But you also know your resources later on if you never need to get back to it. So we'll just leave it at that. Okay, we're talking about two things here. When we talk about hearing, it's not just about hearing. The auditory system is involved in a couple different functions. One of them is the detection of sound waves, which is the thing we call hearing, obviously. But the other thing is the vestibular system, which creates equilibrium and orientation and balance. The way that works is there's parts of the inner ear. So like I told you, we're not going to go through anatomy and we're not going to look at the picture itself, but you have, as the sound waves come in, they hit the tympanic membrane, which is that little filmy thing. By the way, if this is your first time watching one of these, I don't use a lot of the technical language when I'm describing the anatomy, but there's it looks like the head of a drum, basically. And it vibrates, and it touches a thing that touches the other thing, and all of these mechanical parts sort of transmit sound waves down through the system until they get to the nerve, the cochlear nerve. However, inside that system, there is also this place where there's a fluid, and inside the fluid, there's these little tiny hair particles. And those hair particles, as that fluid moves around in our inner ear, as we're moving back and forth, and forward and backward, it sends signals to the brain, so it helps us, decide what our orientation is. If you ever spun around in circles, you ever done that experiment where you take an egg and you spin it around on the table, and then you touch it and it stops, and then you let go and it kind of keeps spinning? Because you're not just spinning the outer shell of the egg, you're spinning the fluid on the inside and it continues to move. And that's why the egg keeps spinning even after you touch it and stop it. The inner ear has fluid in there that moves around and sloshes back and forth, and that translates into, am I upside down? Am I inside out? Wait, that doesn't make any sense. Am I upside down? Am I turning around? And if you spin around yourself, the fluid in your ear also moves kind of like the inside of the egg, and that's why we get dizzy and we feel like we're disoriented and all that kind of stuff. So we're going to be talking a little bit about that. When we hear of things like vertigo, the systems that are involved in that come from the inner ear too. So it's just good to know. Brief recap of function. I kind of just did this, but sound goes in, it goes through a bunch of other parts, gets to the nerve, right? Hearing can include two things, both the pitch or the tone. So think of when a little boy talks in his really high-pitched voice, but then he goes through puberty and hits manhood and his voice gets deeper and it drops. It changes in tone from the high tones to the low tones, right? We're talking treble and bass, something like that. And then also intensity, or the loudness of sound. The pitch, one of the things that happens when you have pitch-related issues is that similar sounding words can kind of blend together, and it can be really hard to discriminate between certain sounds, whether it's, we'll talk about this, be an example here in a second, between the letter X and the letter S. Our mouth moves the same way, mostly, kind of. For the most part, it moves the same way, and the sounds are very similar. X, S, X, S, S, X, S. So you can imagine how somebody who is having difficulty hearing could kind of mistake those two and really just have a hard time understanding the words and what the meanings might be depending on the context and stuff. So anyway, that's good enough. Let's move on. The vestibular system, we've already mentioned actually a couple of these things. So That vertigo stuff, it relates to dizziness and that spinning sensation. I think most of us have probably either heard the term or experienced this ourselves, something like that. If you haven't, spin around 3 times, whatever you're doing right now, just get up and spin around. Unless you're driving, don't do it, but do that. And you'll experience similar what it's like to have vertigo. If you've ever like been so drunk that you like the world is just spinning, it's that same system that's not working the way it's supposed to. Various causes of vertigo. There's a bunch of stuff here, and so I'm not going to go through all of them, but like there are crystals that can form inside the semicircular canals, not in the cochlear part itself, but in that semicircular canals. You could get inflamed in different parts of the ear. Tumors. There's just a bunch of reasons why this can happen, and so again, I think this is kind of a little bit outside the scope of what counselors need to know, but you can go reference the book if you want some more, and even that is probably not good enough. There's probably a whole bunch more that you could do to study, and if you do, you'd become an audiologist and not a counselor, so I'm just going to leave it at that. The test, I thought this test is really interesting. I've never seen this in person, but if you introduce hot water into the ear, you can then see these different reactions of the eyes. The eyes do something. And if you see, one thing we talked about last week with the sight thing, if you remember the term nystagmus, that the eyes kind of drift off even though my gaze is forward. If you fill up the ear with hot water and then the eyes drift off, it tells you something about where the condition might be. And there's a few different kinds of conditions. We'll talk about those in a second too. I already mentioned the first thing, and we're going to talk about lip reading a little bit, so we'll skip that for now. We'll talk about it later. When we talk about classifying various different disorders and what they mean and what's like the definition of what this means, when we say we talk about deafness, we think of total and complete deafness, although that's not exactly what it is. When we talk about hearing loss, you can lose some, but how much and what kind, and all these things have varying degrees to them, right? So typically when we say hearing loss, we're referring to difficulty with conversational speech. So if I'm trying to listen to somebody else and I'm having a hard time hearing the communicated meaning, there's some deficit or some loss going on there. That's sort of how it's kind of measured. That's a very crude explanation, but that's kind of the idea. Deafness, on the other hand, refers to severe or profound hearing loss with the inability to understand conversational speech, even with the potential for amplification. So if you recall back to the sight, the sight and blindness chapter, we talked about legal blindness being an acuity of less than 2200 in the best eye, or the best eye with best sight, and with corrective lenses on. And here we're giving all these kind of caveats too of an inability to understand conversational speech, even if you have a hearing aid in or with some sort of amplification too. So an audiogram can also report classifications of partial, total, temporary, permanent, mild, profound, etc. We're not going to go into the details about what those are, but those are different ways in which this stuff is talked about. The type and location of hearing loss are, and there's typically 2 of them or a combination of the 2. One of them is conductive. Okay, so one of them can be an obstruction of the pathway of the inner ear toward the cochlea. And essentially, this is just a mechanical problem. Remember, you have that little filmy thing, the tympanic membrane, like the top of a drum, and it vibrates as it detects sound waves, or not detects, but like as sound waves push on it, it vibrates. And then that translates to another part, which goes to another part. And those parts in the translation, it'd just be like saying, you turn your steering wheel, it moves the thing, which moves the thing, which moves your tires. And there's a bunch of different moving parts that go into that. It's the same thing. As you turn your wheel, which is connected to this thing, which is connected to the other thing, that's just a mechanical process, and this is a very similar way. The sound goes in, it goes through a bunch of different things to get to where it's supposed to go. Okay, so the reason it's called conductive is because if you ever heard the word conduction, like, you put electricity in water and some materials are conductive and some are not. It's, in other words, another way you can think about it is, will it pass through those various mediums, something like that. If one of those parts in there doesn't work that well, oftentimes you can correct it with hearing aids because we can compensate for those different mechanical parts, so to speak. The other kind of hearing loss is sensorineural. sensory neural. I feel like I'm going to keep fumbling over this tongue twister. My mouth doesn't want to work that way, apparently, so it's harder for me to say. The sensory neural interfaces interference to the reception of nerve impulses, both nerve and hair cells of the inner ear. Another way of saying that is central deafness. Essentially what this means is it's a nerve problem, not a mechanical problem. And nerve problems are a little bit different, and they're harder to compensate with just a mechanical device, like a hearing aid or something like that. So we'll talk a little bit about more specifically what that means, just briefly. And hopefully this will make a little bit more sense in terms of what a sensory neural issue is, and then how it's compensated for, what the medical options are, something like that. In this case, though, one of the important takeaways is that it's usually permanent, because we can't fix nerves in the same way that we can compensate for mechanical parts. Okay, so hopefully that makes a little bit of sense. Sometimes hearing aids can help for different parts of it, but often the need for sign language training, which we'll get to as well. Mixed, of course, is just some sort of combination between the two, depending on which part the mechanical failure is happening in, quote unquote, and what kind of nerve damage, or which part of the system that relays those nerve impulses we're talking about. So just really depends in that situation. The other option, too, is if there's no nerve damage in the ear and no mechanical problem with the ear, that there's a centrally located impairment, which means that there's a brain issue, something going on up here that just won't get the messages, won't get the sensations or the nerve impulses or something like that. Essentially, that means it's not an ear problem. As we've talked about with many other things, these two are just a continuation of other chapters where we talked about other conditions. The age of onset really matters. If you're born without hearing, that's a whole different ballgame than if you acquire hearing loss in an accident, or if it's just a congenital condition that sort of the onset happens in teenage life or adult life or whatever. You're going to deal with it in different ways and go through a different process of adjusting to that. So it's just very different scenarios. I'm not going to talk a ton about it now just for the sake of time, but totally could have a big conversation about that. And then, of course, congenital means from birth. Acquired means it comes on later. You acquire it some way, too. It's just some terminology there. Here, again, are a bunch of different conditions. And I don't think I want to talk about all of them to give a bunch of different descriptions or explanations, because, again, I just think it's more important to spend our time on what does this actually mean for you later on in life? What does it mean for adaptation and functioning later on? So I'll just read these. There's perforated tympanic membrane. So there's a puncture in the drum head of inside your ear. The otitis media, mastoiditis, otosclerosis, tinnitus. The tinnitus is one I'm going to mention just because even if people, if you're not sort of on that hearing loss spectrum, but you have this ringing in your ears, it may not be accompanied with hearing loss, and this is a much more common condition with people who don't even consider it like a hearing loss issue. Tinnitus is just one of those things that can happen for several different reasons, and yet there's still really not a good idea of exactly what causes it. And just like with chronic pain, we've talked about chronic pain. It's like you can give people drugs, and you can try all these different therapeutic interventions from massage to acupuncture and all that kind of stuff. But it really, it's hard to know what's going to actually help with this because the condition doesn't really go away. Sometimes you can get some minor relief from things, but people that have it are just kind of stuck with it. The question is, how do you cope with it? How do you adjust to a life in pain or with this ringing and that kind of thing? So I wanted to highlight that one a little bit because that one can be an important one. Acute peripheral vestibulopathy, Meniere's disease, trauma, and other health conditions, and presbycusis. I had to look that one up. Part of the reason I'm going to tell you this, I went to Google, or what was it, the Merriam-Webster or whatever, and it had a pronunciation of it. There are a lot of words that I just don't know and I've never seen before because I've never met somebody with this condition, and I've read books and I've learned about a lot of things, but no one of us knows everything. I mentioned last week that when it comes to vision and blindness, I've worked with people, I've had clients who have vision issues and also with hearing issues. But two things. One, I don't talk to them a lot about their medical conditions and what's the how did you get it and whatever, because I just don't care about it that much for the most part. There's some situations where it's really important to understand some of the details about their medical records and things like that. But most often, I want to know, well, how does whatever condition that you have affect you? If I know what the condition is, I can come in with some basic understanding of what I assume might be their experience, but I never know. So I just start by saying, you tell me what's going on. In other words, I might get to reading this stuff later and I might have to actually pronounce something, but more often than not, I don't. So if you're out there thinking, boy, there's a lot of conditions here, do I have to know all this stuff? Well, yes and no. You can give yourself a pass to being a medical expert on this, but it is good to see them and to familiarize yourself with how do you find resources. One of my resources is I go to the internet and I ask other people, how do you pronounce some of these things? I'm telling you that at the risk of kind of feeling a little bit like I should probably know this stuff. I'm the professor. I'm supposed to teach you all this stuff. But at the same time, we all are in the same situation where there's a lot to know. And sometimes you go into new clients with new experiences and you say, okay, I'm going to learn on a need-to-know basis. I'm going to learn the things that you have to teach me. And it's my job to be up for that. And sometimes you might have prior knowledge, which is wonderful, but in some cases you won't. So I'm trying to be a little bit vulnerable here to tell you that you don't have to be an expert on everything. It's not a pass to be an expert on nothing, though. So anyway, here again we talk about assessment of hearing loss, and this is really the venue of an audiologist. Sometimes speech language pathologists kind of get into this a little bit because they want to know what the conditions are so they can help a client understand communication differently, all that kind of stuff. Here's a couple of them. I think I'm actually just going to kind of skip over most of this. It's right here. You can read it. The textbook has this information. And I'll just let you kind of do that. For the sake of time, I'll just pass over this a little. Okay, let's talk a little bit about hearing aids, because it's going to be kind of important. There are hearing aids that will amplify sound. That's kind of the primary purpose of them. As we see down like the third or fourth bullet point down, depending on how you're looking at it, there can be analog hearing aids which can amplify sound and also potentially modify frequency. So those are the two things. We have decibels, which measures the intensity of the sound, and hertz, which measures the frequency of the sound, either high pitch or low pitch. Analog hearing aids can do that. They can do that sound information. They can also work a little bit in signal processing. Those typically, the signal processing ones, are not usually analog, because analog has limitations. They're usually the cheapest ones, or the ones that have been around the longest, but they have limitations and they can't really do a lot to filter the sound, and they can't process it and do different things with it. One example of like signal processing is, if you ever heard autotune, some singer, rap artist, pop artist, whatever, they like autotune a little bit, where you can put a sound into the machine, usually a computer, and it will change the tones a little bit based on what it's trying to get to or expecting to hear. It's kind of like saying, take a bunch of white noise and put it through a processor, and the processor tries to find out the relevant information in there. Like if you had a conversation in a crowded area, if you could block out all those other crowded area pieces with the aid of a computer and then just take out the conversation, that's what the computer does. It takes out some of that signal noise. Interesting fun fact is that the way that autotune, it wasn't just made just for rap artists who can't sing or pop singers who can't sing. Originally, it was made for deep sea drilling of oil, because when you send down ultrasonic impulses or signals or something down into the ground, it needed a way, as those things come, it's kind of like let me say this a different way. If you ever seen a bat use echolocation, like in a science movie or something, they go, and they send out this tone, and then it comes back to their ears, and that tells them where mosquitoes are and bugs are and flying things. That's how bats navigate to their food. Well, that's how they find underground pockets of oil and mineral and that kind of thing, depending on how fast the sound comes back and the way in which it comes back or whatever. I don't understand how it works. But that's where autotune came from. Essentially, in this context, what we're talking about is if you get signal coming in and you want to do something different with it, like understand X's and S's differently, you want to process it so you can get more clarity out of the sound, then you can use the digital format, which typically is a little bit more expensive, but it can do a little bit more to reduce outside noise. If anybody's ever used a pair of noise-canceling headphones, they do it with mechanical and digital processes that block out all the extra outside stuff. I'm not an expert in how that works, but in terms of hearing aids and hearing differently, I would expect that there's been some technological advances in the last, I don't know, whatever, 20 years maybe. So somebody who has hearing loss or uses these kind of technologies, they'd be way more informed about it than me, but interesting stuff nonetheless. There are different kinds of hearing aids. Some go behind the ear, which many of you have probably seen. Some go in the ear, kind of like an earbud, like an AirPods or whatever. And some of them go inside the ear canal. It's that style, where you can't even really see them that much. You might see a little antenna sticking out or something like that. But just about every hearing aid, one of the reasons why I say there are advances is because parts are being made smaller, right? Computer parts, phone parts, all that kind of stuff. So the parts are, there's a microphone in there that picks up the sound waves. Then there's an amplifier that can either, amplify them or manipulate them somehow. There's a receiver and then a battery. So all of those parts have to fit in there. And as things kind of shrink and get smaller, not only is it important to have smaller stuff that can be more visually appealing for people, more comfortable and ergonomic, but it also has to fit on their ear or stay in their ear or something like that. So I don't know exactly what all the best options are nowadays, but that would be really an interesting thing to do. By the way, if anybody goes to Costco, just about every Costco that I've ever seen has hearing booths in them. I should probably stop in there one day and be like, teach me a few things. Tell me about your options here. Anyway, another thing you'll either hear or have seen or will hear about is cochlear implants. Now, cochlear, the reason that something like that might be used is if there's a conductive issue. Meaning, remember, we talked about it being a mechanical issue. If the certain parts of the inner ear are damaged or not working for whatever reason, then a cochlear implant might be an option. One of the most fascinating things I did several years ago was that I had somebody come and talk about hearing at a conference, or I didn't have them. I was there watching them talk about this thing, and they had an example of a cochlear amplifier. You can even get headphones that work like this, where there's a thing that goes over the ears, and it just sits right at the back of the ear here on that bone. If you feel right behind your ear, you feel that bone. If you put the end of this amplifier up to that bone, you can actually hear things even though it's not in your ear, which, because probably most of us grew up with headphones either going over the top or sometimes having an earbud that sticks right inside the inside of the ear canal, it's really fascinating to try on these things and use them and see how they sound, because they work really well. When I was doing this, the person had a microphone at the front of the room. She was having a conversation with somebody else, and I was sitting way in the back, and I could hardly hear. I could hear some mumbling, but then I put this thing right in the bone on the back of my ear, and I could hear the conversation clear as day. So we'll talk a little bit about some options for improved hearing in big spaces and stuff in a little bit too. But so that's one option: hearing aids, cochlear implants. If there can be surgical interventions that implant things in the inner ear as well. But those are usually not for those like mechanical parts. They're usually for the sensory neural issues that may come up too. Okay, let's talk about the management. Was I just talking about that? Yeah, I was. Talking about the management of hear loss. There's a typo. Hearing loss and deafness. When we talk about assistive devices, there are a bunch. And this is part of the reason why I don't feel like I'm really an expert on this. So I'll go through what some of the options are just generically, but it seems like every time I learn something new or hear somebody from the deaf community talking about this, maybe not even the deaf community, but like the hard of hearing community is a better way to say it. You'll see in a second why I make a differentiation. But when I hear people talk about this, just like new options and new companies, and new technologies and stuff all the time, and I always feel like I'm way behind. So one option is a telecoil circuitry. Now, the feature of this is that there's a hearing aid that connects directly to a sound source. I don't know exactly what that means. I don't know what that connection means. I don't know if it's like a Bluetooth connection or if there's two devices that are kind of made together. I'm not really sure how that works. But the point is that I have something that I can use on my person, and then I just sort of turn it on, and it gives me more of a direct link to the sound source, either a microphone or a radio, maybe a telephone, that kind of thing. So I'm just going to leave that there because I don't know exactly how that works. But I will say, let's skip down to the third one. We'll get back to telecommunications devices in a second, that second bullet point. But the third one is a hardwired personal listening system. This kind of idea, if anybody's worked, most of you maybe haven't, but if anybody has ever worked at a college or a place like a theater or a concert hall or something like that, where you've had a speaker up in the front of the room, either wear a device, which is kind of like that telecoil circuitry thing, I think. Like they have a microphone, and then a person out in the audience or some in the classroom or whatever will then wear a hearing piece that can kind of give them a closer connection to that person who's speaking, a closer connection to the sound. In the case of these hardwired systems, it could be like there are microphones all over the room hardwired into the space, and the listener just wears like a what's sometimes called like a neck loop or something like that. I forget exactly what they call them. But there is a thing that they'll wear, I think it's audio loop, or an FM signal where they'll just have like a radio earbud kind of thing. Or there's even infrared light systems that do this. But the point is that it's hardwired into the space, or the person wearing something up front will have just like a clip-on device or something. The idea is that you can get the important sound that's coming out of either the whole stage area or just one speaker into that person who needs it. So it'd be like checked out at the front desk or something like that. Another option, let's go back to the telecommunications devices. So this is something that's been around. If you see, you'll notice this sometimes if you start looking for it, but like TDD and TTY, I think this is where somebody else could correct me completely and tell me I'm totally wrong about this. But I think in the old days, whatever the old days means, like maybe 1950s, 60s, something like that, I have no idea when this was. But if you called somebody on the telephone, and of course you're not able to hear them, but if you had a typewriter at your desk, and then you could have it relay a message to somebody else, this is like, by the way, pre-email. I'm guessing this way is just kind of obsolete now. But if both parties had a message they could type out, and then an operator in between would relay that message over the phone. This is back before we had, electronic transfers like email. That's originally where this started. So like this TTY, teletypewriters, which sounds like an obsolete dinosaur of a concept. However, what that translates to, which is still in use today, is there are things just like you're using Zoom and WebEx and FaceTime and WhatsApp and all these video conferencing things. There are now interpreters who you might, through a telephone system, a special TTY system, and there are special devices like this that might even be becoming more obsolete now that we have all these FaceTimes and WhatsApps and Zooms and all that kind of stuff. But there are people that will interpret for you. So if I link into it, instead of sending a typewriter message to this operator, now the operator knows sign language, and I sign to them, and they speak out to the person that I'm trying to connect with. As my little side note here says, I imagine that people within the deaf community who speak the language, I imagine there's more FaceTiming and more talking to each other with through these easily available mediums like FaceTime and Zoom and whatever. But for professional use, you're probably going to see more of the call centers where they have interpreters available to do interpretation for others as kind of like an operator, similar to what we talked about above. So I don't know much about what the culture of that looks like. I dated an interpreter years ago, and she would talk about these call centers, and she had a bunch of deaf friends and stuff that I would sometimes get to hang out with, but not all that much really. But nevertheless, that's what those mean. Again, this is a totally insufficient explanation of what those are, but you'll get to know that if you start working in these areas a little bit more. Let's go back down to captioning for the last part. Fun fact, captioning like closed captioning, you'll see this sometimes if you watch YouTube and you see things on TV, whatever. Subtitles and captioning are different. This is one of those nuances that you'll eventually learn somewhere else, or now you're learning it here, I guess. But captioning captures all the stuff. Here's the people talking, here's what they're saying. Also, it gives you additional information about this kind of eerie music is playing, or exciting sounds, or the puppy is barking, or whatever it is. It just includes more information, giving us stuff about what's going on around based on auditory cues. Something that if you couldn't hear it, you wouldn't know. Subtitles are basically for the purposes of translation, either from ASL to English or Spanish to English, or any language to another language. That's what subtitles are. It's basically just the words without all that additional information too. So that could be helpful to know. And then lip reading is something that people do. However, the book, when they talk about it, they mentioned that, but you can't really do that in dark areas. Or something I hear from students sometimes is, you stand so far away from the camera that I can't really see your lip movements, and it's really hard to do that lip reading stuff. Goes for anybody who listens to this, not just people with who have hearing stuff going on. But in my classes, you don't get to see it now as much. You can probably see my lips a little bit better now that I'm closer to the camera. But what you see if you come into a class is that I'm standing way over there across the room, and I'm like this big on the screen, and you just can't read my lips that well. I've met people who, this one person in particular that I'm thinking about, she was so good at lip reading that she didn't even really need a translator to understand you. And you could just literally talk just like I am now to you. And she just knew what you were saying. And I was always so amazed by that, because if you tried to plug your ears and just watch people talk, you can even do it with me now if you want to. Just watch my lips and the way my throat moves, and the way you can see my tongue every so often when I open my mouth enough. And she would explain it by saying, like, if you watch all those things, you get used to what the meanings are of what people are trying to relay. She was deaf from birth. And then you start to put the facial movements with the things they're intending to mean, and you just sort of figure it out over time. And I was always just amazed by that, that she could do that. Sign language, of course, there's not much to say about that, except there's a ton to say about that. So sign language is one of those things where if you can do it, you have a skill, and it's greatly going to benefit you in your communication with the population of people, of these kind of folks that we're talking about. And then interpreters, I've already mentioned what those are. You guys know what those are, so not much else to say about that. This is one of those things where if you have that specialized skill and specialized knowledge, you can really use it to your advantage. I don't even know what to say about that exactly, but there just aren't enough of them. There are not enough interpreters. There are not enough people who use sign language. The American Sign Language is very American, and different countries have different sign languages too, which relates a lot to the culture, which is what we're going to talk about now. This deaf culture thing is a really fascinating and fun topic that I don't feel like I'm qualified to talk about, frankly. I'm an outsider, and I can say I'm a professor, I'm learned, I know all these things, but frankly, I feel pretty insignificant when it comes to talking about this stuff. I've heard people who are deaf, who live in the deaf culture, who really identify with this different culture, and the more I would hear from them, the more I understand it's like I'm way an outsider here. I do not fit. So enough said about that. This is my own self-consciousness speaking here. But let's talk about it a little bit at least, and I'll do as much justice as I possibly can. One of the important things to understand about deaf culture is that deaf culture does not necessarily see deafness as a disability. So imagine this. Imagine you grow up and you have all your friends and you speak ASL with them, or you sign ASL with them. I'm probably going to get the lingo wrong here, so I apologize. But imagine you sign ASL with them, and then you go off to college to a deaf campus, and you get your education, and maybe your family knows how to sign, and you have but imagine if you did that, you could see getting by in the world relatively well, right? Like if there's enough resources around you, you'd say, well, I'm getting my needs met and things are okay, right? However, when we talked about like the medical model and the social model, the medical model would look at that person and say, yeah, but you're deaf and you don't have the ability to hear, which puts you at a disadvantage because there's a problem there. And the problem is either in your ear or in your brain or whatever. The social model says, well, I'm actually getting by okay. I have a language that I use. I don't really need to hear to get all my needs met, or at least most of them. And so the problem is that when I watch TV, the problem is that it's not captioned. I can't get that information. So if you want to make a television show where I'm a viewer, then you got to fix that. It's not my problem, right? So there's this whole culture of saying deafness is not a bad thing. There are even parents who say, well, if my child is deaf, there's nothing wrong with them. So we don't even need to do surgery. We don't need to wear hearing aids. We don't need to do all this stuff because we have a language that we can use to communicate, to meet all of our needs, something like that. So that being proud, that identity can be both a positive thing, but it can also be a barrier. But it's definitely worth talking about and understanding a little bit of that. I've mentioned before, I don't know if it's in this class, but I mention it quite a bit in other classes and around in conversations here at this school, where Montana has a lot of veterans in this state. And veterans are typically relatively distrustful of people who are not veterans when it comes to doing therapy. In other words, you just don't get it because you've never lived through it. I'm part of certain aspects of a disability community, and there's definitely the sense of it's good to be around people who understand our struggle, who understand our unique situations, right? That's how culture works, is we find the people that fit us and we see ourselves as this group and versus all the other people, right? It doesn't have to be necessarily distrustful, but it's how we build identity. Same thing with the addiction community. People who are addicts say, you wouldn't understand unless you've been there. And I get that part. So, but there's also, at the same time, when it builds belonging, sometimes it can create barriers. The pride and the wonderful, saying, I can be me, just who I am, and other people can change if they want to. That's a wonderful thing. And there's also a whole nother part of this conversation that says, but how do I then accommodate to the rest of the world? And who should be doing that? Whose responsibility is it? This is a huge conversation in boundaries. It's a huge conversation in responsibility. What is theirs? What's mine? All this kind of stuff. And this is really where counseling gets really fun because we get to talk about this stuff. And almost, I've had this kind of conversation with so many people, but I don't have the same credibility. And this is one of the challenges of working in the disability community, is that I don't have the credibility sometimes to say, well, as part of the deaf community, here's how we can change ourselves. Or as an outsider, here's what I need for you to do. I only usually have the power to say, here's the conversation that we're talking about. Here's how I'm willing to learn some new things and accommodate and adapt. I have yet to learn American Sign Language. Would I love to? Yes, but I haven't done it yet, right? So there's so many places in here where we could have this conversation about whose responsibility it was, is it, and what are the boundaries and all that stuff. But the important thing to know is that deaf culture is a thing, and there are lots of individual rules, just like every culture has, and norms and mores, like moral values and that kind of thing, that make it unique and different. And so as an outsider coming into it, the learning curve is pretty steep, partly because the deaf community has been forming for a lot longer than, say, the community on multiple sclerosis. It's a diagnosis that hasn't been understood for quite as long, maybe. So, and there's just not as many people that really get excited about their condition, right? Or feel proud about it or something like that. So it's very unique. If you are part of the deaf community, all you know about Gallaudet University, it's an entirely deaf campus. There are other ones too, but just like we were talking about in the last chapter when it comes to blindness, there are specific schools you can go to, specific resources, lots of programs around the country, and by lots, I don't know if I mean a lot. It's relative, I guess. But Gallaudet's kind of the one that you hear about the most in terms of if somebody wants to go to college. All the professors use ASL. All the students use ASL, to my knowledge anyway. The girl I was telling you about earlier, the lip reader, her husband was a professor there, I think. So anyway, know about it. One of the things too about deaf culture is that there's different behaviors that are specific to that culture too. So some behaviors in the deaf community, like for example, stomping feet, making movements with the body, also tapping people to get attention, kind of touching other people. That stuff can kind of feel rude to a lot of us when we're not used to people inside of our bubble, right? But when you need to get somebody's attention, you can't wave around like this all the time. Sometimes you just need to touch. And so it's not to say that any of those are rude or inappropriate, and which is and which isn't. It's more to say that there are these different ways of being when you're inside the culture versus outside of it. And so getting used to that difference stuff can be helpful if you're going to work with folks. One of the results, I'm just checking the time too, and I need to kind of speed up. One of the results about having a unique culture is that sometimes people like to associate with people of their own culture. Is that a bad thing? Heck no, it's not a bad thing. Everybody who comes in for counseling, wouldn't it be nice if we said, well, here's a support group that you could go to because they're your people, they will understand this, right? And I can do help with this therapy stuff, but boy, it'd be really nice if you could go meet with them on the outside. Well, deaf culture has that. There are people who live, who sign, who live in the deaf culture, who do all that kind of stuff. But as I said earlier, it can be both a wonderful thing, but also potentially a barrier also. But we'll just leave it at that for now. I'm going to check got two more. Okay. One of the functional implications of hearing loss is that children can miss out on peripheral conversations, which can be challenging in school age years, especially, or growing up, because so much of what we learn comes from context. It's not like just teachers, like weirdos like me, who say, here is a thing that you need to know about math and about phonetics and reading and all this kind of stuff. There are things that we very intentionally teach each other, and there's a whole bunch more that we learn from just like seeing things and hearing things and learning from context, and things go in that we don't even really consciously process. And a lot of that comes in through our ears and eyes, and if one of those things isn't working, then we miss out on some of that. One of the things that's true of people with hearing loss, as well as many other conditions, is there's this total myth, total misinterpretation that there's intellectual deficiency or that there's some behavioral problems. Imagine somebody who's just like, you go into a store and you want to buy something, and that person doesn't understand what you're trying to tell them. Like, I want 2 of these, not just 1. Can you help me? And they're like, no, I have no idea what you're talking about. You're like, come on, dude, it's just give me 2 of them, And he's like, I don't get it. And you're like getting frustrated. And they're like, oh, you're one of those, cranky people. So it can be misinterpreted as a behavioral problems when it's not really a behavioral problem per se at all. It's just, it's something completely different. Early intervention, of course, is good, like many things, especially for congenital deafness. But one of the challenges is sometimes hearing loss isn't noticed until later, even though there are some like hearing auditory tests that can be done for toddlers and infants and that kind of thing. During the years of language proficiency, like, when kids are growing up and learning to make sounds and ba 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 ga goo ga whatever, that can be the time to do it, although oftentimes as I understand, it's not caught until later. So part of the challenge too with working with populations like this, what I've found is that it's usually in a vocational rehab context where I'm helping somebody find work. And I have to say, well, now that you're getting used to this new job, this new employment setting, how do we make sure you're safe there? If this place doesn't have fire alarms that also have flashing lights that are really bright, this person might miss out on the opportunity to get out if there's smoke, right? So the safety issue of how you navigate around in the world, particularly in work settings, can be good to talk about. A lot of these things can be correctable. Like there are technological solutions like the fire alarm with blinking lights, like an alarm clock with blinking lights and vibrating things. There's lots and lots of stuff that can be used for these things, but it's just, you have to be very intentional about thinking, okay, what are the potential risks here? What are the things you need in order to communicate with other people? What are the things that other people need to know in order to communicate with you? These are all the things that rehabilitation counselors get to think through. And clients just don't always know that stuff. Like they probably know, like, this is the thing I have in my house. But here's the reason that can't work based on commercial codes in this particular building. And so the rehabilitation counselor can often say, well, I have specialized knowledge about, commercial work settings or different vocational venues, and then help that person and the employer work through, like, well, here's what a solution might be. And as it turns out, these accommodations are not as expensive as you might think, et cetera, right? So one of the other things to talk about is this issue of whenever there's an acquired disability, denial is a potential, right? Like spinal cord injury, brain injury, hearing loss, sight loss, all these things come with denial. So we talked about it in the very beginning of the semester. When people are losing their hearing, that can come along with this irritability from not being able to hear other people. And there can also be frustration on the other person's part when I refuse to support that person for whatever reason. Or not so much on the refusal of supporting that person with the hearing loss, but it's like if the person, they can't hear because they keep saying, what, speak up, or something like that, trying to sound like my crotchety old grandpa. Not mine, but like the stereotypical one. And the other people are like, well, if you would just put your hearing aids in, you could probably hear us. And he's like, I don't need that crap. Imagine that scenario. And this can lead to frustration on the behalf of the person who's having a hard time hearing and the people outside of that. And this is where conflict comes in. And this is where we're having that conversation about whose responsibility is it. And you have people on both sides of any conflict saying, it's not my responsibility, right? This is sort of just a normal counseling situation. This is a really good area where we can come in and hopefully help out a little bit with that. Let's see, what else do I want to say? Counselors not trained in sign language can impede communication and increase reluctance to participate. I don't remember what I was going to say when I wrote that down, so I need to skip over that part because I don't remember exactly what that was all about. So I'll come back to it if I can think about it, but that's all right. We need to get going for time anyway. Reduced socialization is a problem here. I'm going to think that the kids missing out on context cues. One of the things that can just be sort of a normal thing to happen is if I don't know what's going on in your group, and apparently there's like an inside thing that you're all talking about that I'm just not part of, I'll just go over there, right? I'll go find something better to do, either because I don't get it or you're not helping me be a part of this group or whatever, but I'm just going to go away. And that can be one of those things where I'm not getting enough socialization with other people. And that can be an intentional choice. I'd rather be over there than all this weird inside stuff that I don't understand. Or I can be actively excluded from that group because I just don't, I'm not picking up the stuff that they're laying out, something like that. The reduced speed of communication, especially if there's a translator involved, can be one of those barriers that people get frustrated with or don't have the tolerance for. And this is, as counselors, we need to be the people that can be patient with the pace, but also appreciate the silence of waiting for somebody else to communicate to somebody, that kind of thing. So that's something to practice getting good at. Oftentimes, family members end up serving as interpreters for others. This could be both parents and kids. And they can come to resent that role of, okay, it just takes so much energy, so much work to do this. And I'm so sick of people not understanding. And, my son is deaf and I'm having to interpret. This person doesn't get it. And I feel like I'm constantly having to explain things to the other people and then talk to my son afterwards. And it can just be kind of a burning out kind of situation. In some cases, that can lead to family members being gain tighter bonds. I love my son. I'm gonna protect him and help him, and because I care about him so much, we are gonna explain this to other people, and we're gonna communicate with other people, and we're gonna get through this. In other cases, think for example where a child is having to translate for parents. I've met people who have hearing children who have deaf parents, and the children talk just fine, and sometimes the children are like, I don't want to do this. I don't. Other adults are looking to the kids to talk about mom and dad when they should be talking to mom and dad, those kind of weird situations. and it has potential either when the kids are the translators or the parents or whatever. It has potential to dissolve the family unit because maybe the mom and dad are looking to the kid to help communicate something to those other people, and when the kid doesn't want that expectation, and they don't share the same values of like, screw those other people because they don't get it. So it can lead to disillusion of families too, and that can be problematic. So thinking in like kind of a family system sort of way, looking at what are the family dynamics and what are the expectations being put on each other and what are the roles? Because if someone's carrying the role of the interpreter for somebody else, that can be potentially tiresome. This is also true of not just people in the deaf community, but any mental health condition where a parent is the advocate for the child. If they're having to do a lot of that serving as the role of like advocate or interpreting someone's behavior to a doctor who just doesn't seem to understand. It looks weird to the doctor, but the parent says, "Oh, this is just how he communicates that he wants something or whatever." This kind of thing happens a lot. And then, of course, missed opportunities for sex education. If people aren't able to be a part of the class or be a part of those conversations or talk with friends or whatever, like however people get sex education, if that doesn't happen due to people, isolating away from others, not being in general education classrooms, people just not understanding how to communicate. If there's a limited number of interpreters, limited number of mentors, people who you trust, mature adults within any community, you're going to miss out on opportunities to talk about these things that require a little bit more maturity because you have to be able to talk about them without giggling like a fifth grader, like sometimes I do, or in other cases, talk about them in a way that says, here's how safe sex and appropriate sex and mature sex happens in the context of mature relationships. Those kind of conversations, if they're not had, then people miss out. So it's not to say that, the deaf community doesn't have these. Absolutely, they do. But if there's not enough of them happening, then people can miss out on some of that. So anyway, that's it for me. I will see y'all later. Bye.